Hello, good evening, friends. And now we'll be discussing a topic which is asked in general surgery, and among that, it is in the principles of general surgery and also in the recent advances, that is tissue engineering or bioengineering or about stem cells. So, before starting, I would like to thank Chandana Shri ma'am for sharing the wonderful notes with us, and the link for the notes is given in the description below. You can download it from there. So without further delay, let's get started. So tissue engineering, so it requires two things mainly: the cells and the scaffoldings. The cells are the uh, material that divide, or the organism that divides, cells that divide, and scaffolding is the architecture or the support, the framework over which the cells divide. So the basic idea, which is that the cells are isolated and cultured in vitro outside the body by placed on the scaffold, that is the base or the framework where the cells will be placed and then introduced into the body. So cells are isolated, cultured in vitro, then placed on the scaffolds and introduced into the body. So the cells for the tissue engineering could be autologous or allogenic from the same body or from others body, and it could be somatic cell, that is mature cell, which examples are the epithelial chondrocyte, smooth muscle cell, uroepithelial cells, and mainly the stem cells. So these with various types, these are the somatic stem cells, SSC, human embryonic stem cell, that is ESC, and fetal cells, and induced pluripotent stem cells. Now we'll see them in detail one by one. And so before going into the definition, I would like to clear this topic of totipotent, pluripotent, multipotent cells. So as we see, the human embryonic stem cells are example of totipotent cells which arise from the inner cell mass of the embryo in 4th to 5th day of the gestation or post IVF. So these cells, as we can see them in this diagram, the totipotent cell from the zygote, these arising from the zygote, and they are capable of giving rise to all cells in the body and also extra embryonic tissue like the placenta. So these such cells are the totipotent cells. Then the zygote is the example of totipotent cell. Sorry for the delay. So we were seeing embryonic stem cells which are totipotent. So these cells, embryonic stem cells, can be totipotent, especially at the zygote stage or the morula stage, and after slight division in the blastocyst stage, they become pluripotent. So we'll see that also in detail. So first of all, these embryonic stem cells are allogenic and can be rejected, and sometimes can be autologous, where we have, that is SCNT, that is somatic cell nuclear transfer, where we enucleate the recipient oocyte and donate the nucleus and then go ahead with cell culture. And Dolly the sheep is the example of somatic cell nuclear transfer. And then we have the fetal cell or induced pluripotent cells. So these pluripotent cells, they are capable of giving rise to all cell types of the body, but not the extraembryonic tissue. So these are derived from the blastocyst stage, from the inner cell mass. These give rise to pluripotent stem cells or sometimes embryonic stem cells also. So the example of these fetal cells, that these are derived from the bone marrow or blood of the aborted fetus. And induced pluripotent stem cells, these are induced with help of virus, that could be lentivirus or retrovirus, by transfection, and they help in expression of specific transcription factors. So this was pluripotent cells which can give rise to all the cell types in the body, but not extraembryonic cells like placenta. Then we have these somatic stem cells which are multipotent, which can differentiate into a limited variety of specialized cell. So example is the hematopoietic stem cell, mesenchymal stromal cell, endothelial progenitor cells, neural stem cells. So mesenchymal stem cells or mesenchymal stromal cells are most commonly used and widely used for tissue engineering. And in vitro differentiation of stem cells to mature cells are carried out with help of molecules that are biomolecules that are active in BMP4 and FGF, that is fibroblast growth factor 2. And as we have seen, the definitions of the terms, that is totipotent, pluripotent, multipotent. Other is unipotent, which can form cell of only one type, that is the follicular bulge skin stem cells. And then we have one more, that is nullipotent, which is not capable of giving rise to other cells. And if they have been reprogrammed, they can be converted to, these nullipotent cell can be converted to pluripotent stem cells. And how does this happen? De-differentiated into embryonic state, it can be induced by the nuclear transfer, as we have seen, somatic cell nuclear transfer, that is SCNT, or genetic manipulation, viral transduction, and other methods. Transcription factors which are associated with induced pluripotent stem cells, these are OCT4, SOX2, KIF4, and c-MYC. These can reprogram fibroblasts to become pluripotent. Now we will see some of the reported clinical applications of stem cells. So these are in gastrointestinal aspects, that is inflammatory bowel disease, in Crohn's disease, where we use ASC, that is adipose stem cell, where we have surgical implantation of the cells into the perianal fistula. Then others like muscular dystrophy, where we use muscle derived progenitors in the form of local injection. Then ischemic cardiomyopathy through the Magnum trial, where surgically implanted three-dimensional collagen matrix is placed. Again, in ischemic cardiomyopathy, we have systemic injection. In acute myocardial infarction, we have three trials, that is BOOST trial, REPAIR AMI trial, and STEMI trial, where we give intracoronary injections. Then in case of tracheobronchiomalacia, we have differentiated form of chondrocyte which are surgically implanted, Then traumatic calvarial defect in case of brain, where again we use the adipose stem cells for surgical implantation in the fibrin glue. And lastly, the achondroplasia, where we have transplantation concurrently with distraction osteogenesis. Some of the other application which I would like to share are patients of burns or skin defects after excision or trauma, that is skin graft, tissue engineered skin graft. Then in case of eye, for any retinal or corneal condition, in cardiac for heart failures, that is ischemic cardiomyopathy will give rise to that, and heart valves for congenital heart disease and acquired valvular heart disease, cartilage and bone as we have seen in achondroplasia, trachea and bronchus as we have seen in tracheobronchomalacia, bladder in case of congenital bladder malformation, and post cystectomy after malignancy or trauma. Sorry for the delay. So we were at bladder, which can be reconstructed in congenital bladder malformation and cystectomy, and anal or bladder sphincters in case of incontinence, pancreatic islets in case of insulin dependent diabetes, blood vessels in case of atheromatous disease, aneurysms or traumatic arterial disease, esophagus for benign stenosis or in case of malignancy, intestine as we have seen in Crohn's, cancer or ischemia. So these are some possibilities of other uses. And so let's get ahead. So mesenchymal stem cells, which are most commonly used in the body. So these mesenchymal stem cells are multipotent stem cells, and these are harvested from the bone marrow aspiration from the iliac crest or from liposuction, that is subcutaneous fat, and can also be received from the umbilical cord, and they have some certain surface marker that are CD105, 73 and 90, and they have the ability to adhere to the plastic, and they do not have surface marker of the hematopoietic stem cells, that is CD34 and 45, and they can differentiate into osteoblast, chondrocytes, adipocyte, tenocytes and myocytes, and can also directed into ectoderm and endodermal lineages, and they have the ability to give the anti-inflammatory factors like the growth factors, that could be VEGF, that is vascular endothelial growth factor, insulin like growth factor, hepatocyte growth factor, prostaglandin E2, and they are isolated in vitro on the basis of their ability to adhere to the plastic also. So these can contribute to cell regeneration. Also, they can help in immunomodulatory and paracrine effects through their ability to release trophic mediator and help in tissue repair by the recipient cells. So stem cells with certain surface marker 90, 73 and 105, they can help in immunomodulation, have paracrine effect, trophic effect like the growth factors, regeneration, and can also give rise to tissue regeneration like the osteoblast, chondrocyte, adipocyte and myocyte, can differentiate into multiple lineages and can work with other populations. So now something about the scaffold, and before going to this I would like to just discuss this. Yeah, as we have seen that these multipotent stem cells rising from the adipose or the bone marrow or the umbilical cord can give rise to adipose, osteogenesis, chondrogenesis, skeletal myogenesis, cardiac myogenesis and neurogenesis. So let's get ahead with scaffolds used for tissue engineering. So scaffold, these are the structural support for cells. The cells which are going to be dividing allow cells to attach, migrate and proliferate. So these will be supporting them and help enable oxygen, nutrient and regulatory factors access all the cells, deliver signals to promote cell migration and proliferation, and these are biocompatible, non-immunogenic and also biodegradable. Some summarizing points: these providing the support and shape the engineered tissue, guide cell growth, migration and differentiation. It could be natural or artificial. Natural is obtained by treating human or animal tissue with detergent to remove the cellular content and then obtain a collagen rich extracellular matrix, that is decellularized organ scaffold. Then the artificial, which have the natural material and the synthetic material. Natural material are the polysaccharide, collagen, fibrin, gelatin, cellulose, and these are composite biomimetic. These are called the smart scaffolds, and these have the biophysical cues and cellular signals. Then we have the synthetic materials which contain polylactide, that is PLA, polyglycolide, that is PGA, graphene, bioactive ceramics, calcium phosphate hydroxyapatite, bioactive glasses, and these can be crafted into desirable architecture, shape and texture using 3D printing and electrospinning. We'll have a discussion on these separately, but this was all about scaffolds and cell seedings of the scaffold. So how do we seed the cells into the scaffold? That could be static cell seeding, where we give concentrated cell suspension directly on contact with the placed in direct contact with the scaffold. Then we have dynamic cell seeding, that is rotation of the scaffold in the cellular medium. Magnetic cell seeding, where the cells are labeled with supramagnetic beads and magnets are used to attract cells into the scaffold. Pressure and vacuum seeding, to force cells into the pores of the scaffold. Photopolymerized hydrogel, where we use UV rays onto the monomer cells of suspension. Bioreactor perfusion systems, these are some methods of cell seedings into the scaffold. Then implantation of the engineered tissue have consideration, like it will lead to remodeling at the target sites and the mechanical stress at the target sites. What are the risks of the cell-based therapy? The bioengineered cells, that is tumor formation, genetic and epigenetic abnormalities, infection, poor viability, loss of function of the organ, de-differentiation into undesired cell types, rejection of the tissue, side effects of immunosuppression, especially in the case of allogenic cells, and some ethical considerations. In short, about the history, it was first started, the first cell transplant, bone marrow transplant, started in 1968, and over time it has grown to 3D printing of vascular networks, direct therapeutic angiogenesis in ischemic condition in 2019. Then the angiogenesis engineering, where various cell sources are used for vascular regeneration, the embryonic stem cells, adult stem cells, and somatic cell reprogramming, which give rise to induced pluripotent stem cells. Adult stem cells will give bone marrow circulatory system, and the embryonic stem cells, the inner cell mass of the blastocyst, will give rise to sorry, endothelial cells, and will give rise to angiogenesis to help vascular regeneration or induction of angiogenesis. And many cell sources are applicable to regenerate various tissues by affecting angiogenesis and blood support. So this was all about tissue engineering or bioengineering and some basics about stem cells, stem cell scaffolds, and hope it has been understood in simple ways. And keep studying, keep growing, never give up, because great things take time. See you in next video. Until then, study and keep growing. Please like, share and subscribe. Thank you.